Welcome, dear members. Today we are going to discuss one of the major concepts which is being explained in Ayurveda, that is the concept of ama and its application. How we are going to apply the concepts of ama present day. So before going into the description proper, here we are going to discuss uh, we are going to discuss about the concept of the um, clinical application of AMA in the present day. Before going into the concept of proper, here we are going to discuss about the some of the very basic concepts that we need to concretize as far as Ayurveda is concerned. First, if physics, chemistry, and biology and Ayurveda fundamentals are well known, then every information or every concept mentioned in Ayurveda can be learned with deepest understanding. So, second, when you want to know about the Ayurveda concepts with the deep dive understanding mechanism, so we have to practice the concept of minimalism. What is the word minimalism? Minimalism refers to we are going to look into one particular small topic. So we are going to look into from multiple angles. That is, first of all, we are let us look into, for example, we are going to learn the concept of dosha. So from the point of Rachana Sharira point of view, from the Kriya Sharira point of view, from the Roga Nidana point of view, from Samhita Siddhanta point of view, from the Rashastra Vaishnaja point of view, or from the Dravyaguna point of view, or from the point of Agadha Tantra, or from the point of Kaya Chikitsa, Shalya Tantra, Shalakya Tantra. So that means from the multiple angles, we are going to look into one particular concept itself. So that will be helpful in having a deepest understanding. So, in the same way, when you look into the concept of Roga Marga, that is in the same way we have to look into from multiple angles. That will be giving us a deepest understanding. Third aspect, that is when we want to know about each and every corner of Roga Nidana, then we need to know about Kriya Sharira from each and every corner. So that means, so from each and every concept that is being explained in Kriya Sharira, we have to have the deepest understanding. Then only we can have a beautiful understanding of Roga Nidana. If you want to have the Kaya Chikitsa learning very easier, then you need to know about the concept of Roga Nidana very well. In other words, to say, so Kriya Sharira, knowledge, extended Kriya Sharira is nothing but Roga Nidana, and extended concepts learning in Roga Nidana, that is nothing but Kaya Chikitsa. So that means if you want to have a well-versed understanding, if you want to have an expertise in Kaya Chikitsa, then you should be having a expertise in Roga Nidana, and you should have expertise in Kriya Sharira. Fourth major concept, that means whenever if you are going to learn the any of the informations, so try to identify the pattern in the sense that is repeatedly occurring observations. For example, if a person is taking any of the Nidana Sevana, for example, let us take the concept that is the person is taking 300 ml of curds mixed with salt for a period of 10 or 15 days at around 10 p.m. So that means, see, he is having the repeatedly occurring events at 10 p.m. Repeatedly occurring exposure to etiological factor. That is the amount repeatedly occurring observation having the exposure of similar amount, that is 300 ml of curds mixed with salt. See, that is actually responsible of the increase of pitta dosha in the body. Suppose if the person is adding some amount of the pepper, some amount of the green chili, some amount of the what do you say that the asafoetida or hingu. See, that is actually responsible for the pitta dosha vitiation to the maximum extent. That is the reason we have to be very careful, identify the patterns. So, what is the benefit of this? Suppose if the person is taking, for example, 10 events are being happening, to have a 10 steps are happening. Suppose if you are observing fourth step, till fourth you have identified the pattern, and if the same thing is happening, you can able to predict what might be the fifth step, what might be the sixth step, what might be the seventh, eighth, or ninth, or tenth step. That is the benefit of identifying the patterns. So this actually, if you are identifying the pattern, then modify that particular pattern. When you say that modifying the pattern in the sense the person is consuming, what you say that the curds mixed with salt, that is actually responsible for the increase of pitta dosha. The modification in the immediately stop that particular pitta dosha vitiating diet. In other words, pattern creation in the sense person has to take the other substances which are not having amla rasa or the lavana rasa, etc., which actually in turn responsible for the mitigation of pitta dosha in the body. And fifth major concept, no compromise in Ayurveda fundamentals will be done in this particular uh, channel. And the sixth major thing, that is you need to follow one particular mentor. So That means when you look into the present day, in the social media, maybe in the YouTube, etc., millions of informations are available. Crores of informations are available. So their own identity, their own ideation, their own process, etc. So that means if you are looking at multiple uh, mentors, that means they are having their own ideations, they are having their own processes, etc. You are not in a position to follow what is actually happening in that particular events. So what actually happening in one particular thought process? That means because you are observing multiple thoughts. When you are observing multiple thoughts, the uh, you are not in a position to come to a particular conclusion where you want to channelize your thought process. Hence, follow one particular mentor. So that means if you are observing one particular mentor, his videos continuously, or he is what do you say that the speech continuously, you can able to identify what he is saying in the past, what he is saying at the present, and what he may say in future. That is, the prediction may be possible if you are following one particular mentor. Hence, try to follow one particular mentor in that particular regard. So then, whenever if you look into the present information, collecting the information. So collect the information, Ayurveda information as per the Ayurveda fundamentals, collect the information as per the Western information, and try to link these informations at multiple intervals. If you are able to link these two informations, Ayurveda information as well as Western information at multiple levels, then it is suggestive that you are going in the right direction. If it is not possible for you to mix these information at multiple levels, probably that may indicate that you are not in the right direction. That is the major thing. And sixth major information that we need to know about, that is learning Ayurveda like a new language. When you say about learning the new language, so that means most frequently used words you have to learn first, then less frequently used words, then less frequently used words, then less frequently used words. In that way you can able to uh, learn these new informations, that is learning the new language as such. And next, about the concept of digestion. Before going into the concept of ama, we need to know about the concept of digestion. So here this is a schematic representation of the human body. When you say about schematic representation, in the sense, the first and foremost extreme left, there is an alimentary canal which is having five main suborgans: mouth, esophagus, stomach, small intestine, and large intestine. And extremely right to that, that is intravascular compartment. That's nothing but the blood vessels. And extreme right to that, that is interstitial compartment. And extreme right to that, that is intracellular compartment. When you say about this, so you need to know about some of the gut transit time also. Whenever if you are speaking about the formation of ama, digestion and assimilation disturbances, you need to know about these informations also. So when you say about gut transit time, what actually gut transit time refers to? Gut transit time is nothing but the the presence of the food and one particular organ for a specified time period. That means in the mouth it may remain for a period of 2 or 3 minutes, depending upon one's what do you say that the mastication process, etc., etc. So the whereas in this esophagus the food may remain for a period of few seconds. There is no storage that is happening in this esophagus. In the stomach, so there will be the storage of food may take place for a period of the 2 hours, wherein the macromolecules which are being considered to be entering through the mouth, that may be converted into intermediate molecules, and sometimes macromolecules may also be present there. And this particular food substances that may remain in the stomach for a period of almost 2 hours. After that, the food may will be entering into the duodenum. That means entering into the small intestine. And then in the small intestine, these macromolecules or intermediate molecules will be converted into the micromolecules. From there, it will be entering into the intravascular compartment of the small intestine. Thereby, it will be entering into the portal vein there. And after the 6 hours of stasis in the small intestine, the food will be entering into the cecum, and there the absorption or the stasis of the food may remain for a period of 24 to 48 hours. And after that, this will be undigested food residue will be entering further into the sigmoid colon. From there, it will be entering into the rectum. Then it will be expelled through the anal canal from the anus. It will be expelled out. In the same way, the pathogens that will be moving from the mouth to small intestine as well as large intestine. Whenever there is the entry of pathogens are happening in the from the mouth, so there is no chance of proliferation in the small in the mouth, as the food may not remain for longer time period, until and unless if a person is not following proper oral hygiene, there is no question of the infection to occur in the mouth. In the esophagus, there is no question of what do you say, that the proliferation of microorganisms, as the stasis of the food may not remain for longer time period, even the time period that is being spent in the mouth, even that amount of time will not be present in the esophagus. Hence, there is no question of proliferation there. Then, when the food is entering into the small stomach, small intestine, and large intestine, the amount of the food that is remaining in these organs, that will be prolonged. That is the reason there will be a possibility of a proliferation of infection may be possible. So, further, what are these different abnormal diet patterns that can be observed in an individual? So, wherein Adhyashana, Vishamashana, Samashana, Viruddhashana, and Atyashana. So, these are the different ways wherein the person may have abnormal diet pattern. Wherein Adhyashana, the term Adhyashana refers to where the person is consuming the food prior to the digestion of a food, or that is already being present in the stomach region. Wherein Atyashana is the one where the person will be consuming the food at a particular time period itself, wherein the food will be entering or the will be filled in such a way that the food will be, after the consumption, some amount of food may remain even in the upper end of the stomach, and even sometimes even in the esophagus also. That's what we can say akantha bhojana, wherein the vishamashana refers to where the person is not in a position to, where the person will be having the abnormal diet pattern in terms of quantity and in terms of timing. What do you mean by in terms of quantity? In the sense what? Wherein the some of the times with the person will be consuming the food will be in large quantity, and sometimes we will be taking very little amount of quantity. This is exactly is happening in the home by the mothers, wherein some of the occasions mothers they will be taking too large amount of food, so that the food may not be uh, present. The food may not be from the next day. It should not be kept. Sometimes they will be taking very little amount of food. That is what is considered to be. And sometimes this can even happen in the hoteliers. The Vishamashana, this is basically happening. And sometimes even the people who are businessmen, so where they are concentrating upon their own the business growth, in that particular situation, Vishamashana can happen there. Whereas Samashana refers to where Pathya Bhojana and Apathya Bhojana, that is wholesome diet and unwholesome diet, will be consumed by an individual at a particular time period. So it is being mentioned that the person is consuming fish. It is not ideal to take milk. But the in case of the Samashana people who are doing that, they will be consuming at a particular time period. This is considered to be Pathya and Apathya Bhojana together. Why? The milk is having Shita Virya and Matsya is having Ushna Virya. They are not good. They are considered to be exactly considered to be having the opposite qualities in that particular situation. wherein the term Viruddhasana refers to where the person is taking unwholesome diet or incompatible diet. When there is incompatible diet is consumed, what actually happens then? That is immediately responsible for the inflammation to occur in the stomach as such. So in all these occasions, the source of entry will be mouth. So in that particular situation, what actually happens is because of these reasons, adhyashana, etc., the first and foremost that happens will be Agni-mandya. When there is Agni-mandya is happening, the three main functions that are being disturbed. That is the first and foremost that is dilution of the hydrochloric acid, then inability to convert the pepsinogen into pepsin, then there will be gastric mucosal damage. These are the three major mechanisms that will be happening. Now, how this particular dilution of the hydrochloric acid that may happen, let us look into that. First of all, let us assume the person has taken the, let us take the example of adhyasana. Initially, the person has taken the food that is actually remaining in this particular region. Within a matter of 2 hours, the person is again consuming the food. This actually is responsible for the displacement of already present food in the lower end of the stomach, which may be getting displaced, and these are usually considered to be macromolecules or intermediate molecules. And these are the already newly taken food, they are usually considered to be macromolecules. They will be getting displaced, and these are responsible for the movement to happen to the distal parts. And immediately after consuming the food, there will be the closure of a pyloric anther for another period of 2 hours. In that particular sense, so that means these food may remain, that is the macromolecules or intermediate molecule, they remain on the either greater curvature or lesser curvature. So, and after that, so after a matter of 2 hours later, what actually happens is this pyloric anther is going to get open, and these molecules, they are being present at the distal end, they start moving first. Whether they may be either macromolecules or either it may be intermediate molecules. So after that, these macromolecules or intermediate molecules, they are being present on the greater or lesser curvature, they start to enter into the small intestine. So during this particular time period, before this particular time period, that is after the adhyashana. So when you say that is adhyashana, that's the content of the food also matters. When you think about it, most of us will be consuming the carbohydrate-rich diet. When there is carbohydrate-rich diet is being taken, this is responsible for the proliferation of a infection to occur in the stomach. When there is proliferation of infections, infectious pathogenesis happening, that is actually leading to the gastric mucosal damage. So this in turn leads to the entry of macromolecules or intermediate molecules to happen into the interstitial compartment of the stomach. And as they are as the molecular weight of the substances entering into the interstitial space of the stomach is more, they are not entering via liver to the via portal circulation, they will not be entering into liver, they are moving via lymphatics to the thoracic duct. From there it will be entering into the junction superior vena cava at the junction between left interjugular vein and left subclavian vein. When you think about it, this is what actually considered to be the person is consuming adhyashana, vishamashana, samashana, and viruddhashana. This actually leads to the concept called the pathogenesis called Agni-mandya. And when there is Agni-mandya, three major functions will be at fault. That is dilution of hydrochloric acid and inability to convert pepsinogen into pepsin. This is happening only in the presence of hydrochloric acid. And this, because of the inability, whatever these contents they are being present in the stomach as a macromolecule, they are not in a position to convert it into intermediate molecules or micromolecules. So because of that, there may be a possibility inflammatory reaction to happen in the stomach. Thereby, there may be a possibility of damage to the gastric mucosa. So that means there will be Agni-mandya will be there, These are the three major functions that may be happening in because of the Agni-mandya. So this in turn results in the deposition of macromolecules or intermediate molecules to uh, the either greater curvature as well as lesser curvature of the stomach. That is nothing but the presence of ama. From there, the damage because of these inflammatory markers are being produced in the stomach. These inflammatory markers, they are nothing but the proteins. They are entering into the interstitial space of the stomach. From there, they are entering into the lymphatics. Thereby, that will be entering via the entering into the superior vena cava. From there, it will be entering into the heart. So that means thus the ama formed will be entering into the blood circulation, excluding or the bypassing the portal circulation. And this one, I think we have discussed it in an elaborate manner. That means whenever the person is consuming the food, in the similar manner, the pathogens will also be taking place into the stomach, and because of that, so they are considered to be pathogens, foreign bodies. They are responsible for the inflammation or infection to occur in the stomach. From there, it will be why infection that will be predominant in the stomach, because we are consuming carbohydrate most of the occasions, and when there is carbohydrate, in the sense the microorganisms, they proliferate rapidly in the carbohydrate, what do you say, that substance. When there is carbohydrate is being present, these microbes, they proliferate very rapidly, right? So this is about the pathogen there. Then about the concept of pathogen entry into the small intestine and large intestine. Let us understand this particular concept. Whenever we are saying that is the adhesion is happening, we said the food will be remaining in the stomach for a period of 2 hours. As the person is having poor hydrochloric acid and poor pepsinogen, the macromolecules will not be converted into intermediate molecules or micromolecules. In that particular sense, these macromolecules, they enter as macromolecules itself in the small intestine. So that means they are moving on the wall of the small intestine. So that means they are actually in the similar way, they are going to damage the mucus of small intestine. So that means, so these are responsible for the inflammation or infection to occur in the small intestine also. Thereby, there may be a possibility of damage to the small intestinal mucosa. So thereby, they are responsible for the inflammatory markers to be produced in the small intestine, and these inflammatory markers, they are actually responsible for the what do you say, that the entry of these pathogens or inflammatory markers directly into the interstitial compartment of the small intestine. From there, it will be entering into the lymphatics, thoracic duct, then superior vena cava, and then heart, and then general circulation. So this is what actually is happening in terms of small intestine, because these are considered macromolecules, and as these macromolecules are unable to convert it into intermediate micromolecules, the same are going to enter into the large intestine. That is, macromolecules will be entering into the large intestine, thereby blocking the secretions even in the large intestine also. As we are consuming carbohydrate rich diet, so that means, so these are considered to be again responsible for the inflammation to occur in the large intestine also. So that means, so as they are heavier molecular weight, they are having heavier molecular weight, again they are responsible for inflammation to occur in the large intestine, and uh, carbohydrates that is responsible for infection to occur, large intestinal mucosal damage. Thereby, these are responsible for the entry of these inflammatory markers as well as the macromolecules or intermediate molecules into the the interstitial compartment of the large intestine. Thereby, there will be the entry of these uh, what do you say that the inflammatory markers as well as macromolecules from there into the from there into the lymphatics, from there that will be entering into the thoracic duct, then heart, then general circulation. In that particular sense, this is what is considered to be the concept of ama. Specifically, we can say it could be sama kapha as such. Whenever this particular mechanism is happening in the small intestine, we can say it could be sama pitta understanding. When the same thing that is happening in the large intestine, we can say sama mata understanding. The and the next about the facts of the capillaries. Before going into the one major concept that we are going to learn today, what actually these armor that will be happening, where why they are going into that particular region itself, we are going to learn it. Before going into this particular concept, we need to know about some of the facts of capillaries that we have discussed in the earlier time period. Total human body that is containing total amount of some amount 10 billions of capillaries. They are present in the human body. When you say about 10 billions of capillaries in the sense, so that means for each and every aspect, that is the very micro level, that is the billions capillaries are being present. So here look into that. See here, one, two, three, four. In this particular itself, these examples, nearly around four capillaries are being present there. So like that, 10 billions of capillaries are being present in the overall human body. Though heart pumps the blood nearly 60 to 100 times per minute, capillaries will have the movement only once or twice per minute. So, depending upon one's nature of oxygenation of the particular tissue, depending upon the nature of nutrients requirement related to the tissue, etc., that is going to have only once or twice the movement of the blood will be happening in the capillaries. And when you think about the movement of the blood in the capillary, that is around zero point 0.3 millimeter per second. 0.3 millimeter per second, that will be the movement of the blood that will be happening in the capillaries, and diameter of the capillary is something around 4 to 9 microns. It is the total diameter of the capillary, and total thickness of the capillary that is around zero point 0.5 micrometers or 0.5 microns. That will be the total thickness of the capillary wall. Now, when you look into this particular overall, this is again an overall image of the total human body in a different angle. That means, suppose the all this is, let us look into that. This is a what do you say that Abhyantara Roga Marga, right? When you think about it, suppose this is considered to be the overall representation of the parts of the body: upper limb, lower limb, trunk, and that's the head and neck. You say about, if the person is doing excessive writing, if the person is doing excessive cutting, if the person is doing more amount of exercises in relation to hand, so that means when a person is doing that particular activity, more and more blood supply to happen to the capillaries to the upper limb, right? When a person is doing walking, when a person is doing running, or when a person is doing jumping, etc., when a person is doing that, then more amount of the blood circulation will be happening into the lower limbs. And when a person is doing any of the activities which is related to the abdomen, such as the what do you say that the what do you say that the yoga practice, or the some specific asanas where the person will be having the excessive movement of the abdomen, then trunk that will be receiving the blood supply, increased blood supply. And when the person is doing thinking exercise, or when the person is doing playing chess, etc., the head will be receiving the a maximum amount of the blood. So that means, as we have mentioned in the earlier, so normally, if a person is in an at rest, once or twice the person will be having the movement of the blood in the capillaries. If the person is doing these kinds of the activities, such as excessive writing, the amount of the blood to the upper limb capillaries that may be increased to 10 to 12 times per minute. So, whereas others as said that may not be having that much amount of the increase of the blood supply to the other parts of the body. That is the reason when a person, depending upon the nature of the exposure, etiological exposure, the person will be having the movement of the what is it pathogen. Suppose if the person is having the pathogen here, and if a person is doing more amount of the writing or vegetable cutting, etc. For example, a person who is considered to be a cook, in that particular situation, a pathogen which is being present in the stomach that may straight away enter into the upper limb. From there, that may enter into the interstitial compartment of the upper limb and intracellular compartment of the upper limb. Whereas if the person is considered to be a marathon runner, though all the body that may be having an exposure of this, but blood supply, more amount of blood supply to be present on the skeletal muscles of the lower limb. From there, it will be entering interstitial compartment. From there, it will be entering into the intracellular compartment. More amount of the thinking activity or playing chess, etc., that may lead to entry of pathogens from there to the head and neck blood vessel. From there, it will be entering into interstitial compartment. From there, it will be entering into intracellular compartment. And the take home messages from today's discussion, it is source of entry in case of ama formation in the GIT, that will be most commonly almost 90%, 99% of that will be through oral cavity because of a abnormal diet pattern. The abnormal diet pattern that can be observed in the human body, it could be adhyasana, that is wherein the person will be consuming the food before the digestion of previously ingested meal. Vishamashana, abnormal diet pattern in terms of timing and quantity. Samashana, the consumption of wholesome and unwholesome diet together. Viruddhashana, where the person will be consuming incompatible diet at a particular time period. Whereas Atyashana refers to the consumption of large amount of food at a particular time period. By applying the principles of physics, chemistry, and biology, we can have a deep dive knowledge of ama. And any concept can be learned with deep dive method, that is by applying physics, chemistry, and biology. So, any queries from your side? That is most welcome. Okay, if there is no question, then we will wind up the session and we will be having some more discussion in the next session. Have a nice day. Thank you.